So in this video, we're going to show you how we treat deep wounds. So first of all, we spray the wound to clean it with a solution of chlorhexidine, 1 part to 5 parts saline. And then we dab around with the gauze, cleaning bits of dirt very gently, rubbing away bits of dead skin, discolored brown skin, and just make sure it's clean. Then we use a gauze, a clean gauze, and completely soak it in Manuka honey. We use grade of 430 mg, and the higher the grade, the better. Now you want to completely cover the gauze. You don't want to have any bits of gauze without Manuka, because that gauze can stick to the wound and it's very painful to pull it off for the dog or the cat. So once it's completely soaked in Manuka, you want to gently lay it over the top of the wound, making sure every part is covered, and then just pat it down, getting it to stick around the edges of the wound. Now you can use brown sugar. We've also used brown sugar because Manuka is expensive. Brown sugar, you just put brown sugar directly on the wound and then cover it with gauze. So if there's any part of the wound not covered, you'll need to get another piece of gauze and do it again. So this is Rina, the shelter manager, and then Rudylyn, the head vet assistant. So she's making sure that all the parts are covered. And we actually get a lot of these kind of wounds here in the Philippines. Usually starts off as a small cut or injury from a fight or from something, and then it gets infected. With the climate here, it can get infected quite quickly, and then flies lay eggs, then maggots start eating away, and then before long you've got a massive open wound. So after you've put the Manuka gauze, you want to then completely cover with clean, dry gauze. We need to ensure that there's nothing can get into that wound, and that it's clean and completely covered in Manuka. So just for a little bit of extra coverage, Rina's put in that over. This is Kobe. Over Kobe's head. He's such a good boy. We have to use a muzzle though, because he has a tendency to bite. He's obviously a new rescue. Now this can be the tricky bit. You need then to keep it all in place. We use vet wrap. It's like a adhesive tape. And you want to put it tight enough to keep it in place, but not really tight, because if it's really tight, it can cause swelling. So just tight enough to keep it in place, but not too tight. Now you can do this. We're obviously doing it on Kobe's head, but you can apply this to any wound. The difficulty is keeping it in place. So you would have to usually use a cone on the dog and then wrap around whatever part of the body the wound is. So this is probably the trickiest bit, but obviously our staff have had a lot of practice. And once it's all fixed in place, you don't want to remove it every day. We leave it 2 to 3 days before we take it all off, and we do this exact same procedure again. A wound like Kobe's will probably take 6 to 8 weeks to fully heal, and you can see some examples of before and afters at the end of this video. They're quite horrific injuries, but they all recovered. So just remember that when you're watching them. So you want to, with a head wound, you want to wrap it around the neck. We have to keep his muzzle on, so it's a bit tricky there. Again, not too tight. But tight enough to keep it in place. And as I said, you only change it, do the same thing every 2 to 3 days, not every day. It won't heal well. And when you remove, if you see little specks of blood on the wound, that's really good. It means it's healing. Obviously not blood pouring out, but little specks of blood in the wound is a really good sign. So you just repeat this procedure until the wound heals. And there we go. There's Colby on his way to healing. So here now, I'm going to show you some dogs that had horrendous wounds coming up in a minute. Now here is Nellie. Nellie had a horrendous wound on her face. Her eye hadn't disappeared. It had just been pushed to the side. Again, maggot infested. And with Manuka, here she is. Unfortunately, she did die from kidney failure in the end, but she fully recovered from her injury. This is Ezra, hit and run, scalp taken off. And again, the same process as you've just seen. And she made a full recovery. And the last one, Huxley, is probably one of the worst ones that we've seen. Half his head was missing. But again, this took about 3 to 4 months. Most people would say euthanized, but look at him. He is such a lively bundle of joy. And he's still got scars, but he's fully healed. So it is absolutely possible to heal these horrendous wounds.